Hi, I'm Joe Ruffalo, the President and Chief Executive Officer of Niagara Falls Memorial Medical Center, and I'm here with John Durno, who is our Administrator of the Sholkoff Nursing Home Facility. A couple of things today. I want to give you a COVID update, and then I would like to introduce John and talk about some updates with our Sholkoff Nursing Facility. First, today's daily report from Niagara County was just released. There are 33 more positive cases that have been identified since yesterday. Again, keep in mind there's very limited testing that is going on in Niagara County, and basically it's for patients, nursing home residents, healthcare workers that are symptomatic of the COVID virus for the most part. So that brings the county total to 359 positive cases out of a total of 1,635 that were tested. So it's roughly about 23% of those tested have been tested positive. With respect to Niagara Falls Memorial, today we have 6 positive cases in-house. 3 are in critical care and 3 are on the regular medical floor. We've been pretty much plateauing at that range between 6, 7, maybe 8 positive cases at any given time within the hospital. The good news is that of a total of 49 positive cases that have been tested out of 174 total tests, 37 of them have been discharged and have either fully recovered or in the process of recovering. Again, interestingly, when the numbers are small, it's only 49 positives, but when you look at some of the demographics, roughly 57% reside within a 2-mile radius of the hospital's campus, and another 15% reside within 1 mile of the intersection between 93rd and Acuga Extension. So those are primarily the 2 major clusters of patients that we see here at Niagara Falls Memorial. Again, if you look at countywide, close to 65% of the total county positives are in the western part of Niagara County, mainly in Niagara Falls, Wheatfield, North Tonawanda, Town of Niagara, Cambria, and additional amounts in Lewiston. When you look at the demographics of our 49, 53% are female and 47% are male, which is kind of flip-flopped as compared to a week ago. And 33% are African American, and that compares to a city percentage of African American of 23%. So clearly there is a health disparity issue there. And when you look at the age range, the females that tested positive, their age range is from 30 to 69. And for the males, the age range has been from 50 to 79. So it's a younger age group within females than males. Again, keep in mind, these are the 49 positives that were tested here at the hospital. So it's a small sample size. It may not be statistically significant, but it gives you a feel for some of those demographics. So I'm here with John Durno, and the nursing home currently has 102 residents. There is only one resident that tested positive within the 102 residents that reside there. So, John, maybe you can give us an update in terms of how you've been able to maintain, thank God, a very, very, very small number that have been infected with the disease, with the virus at Sholkoff. What are some of the additional precautionary measures that you and your staff have taken?
Sure. First off, we're blessed to have very caring staff that's very cognizant of the COVID and to take care of the residents. And twice a day, or twice a shift, I should say, that the staff are temped. They're going to, once they come in, they're going to have their temp taken, and halfway through the shift, their temperature will be taken again. They're wearing masks. Anybody that has some indications that they have a higher temp, I'm speaking of the residents, staff is cognizant. We have all the appropriate protective gear so far as gowns, eyewear, gloves, etc. So we're well prepared to take care of the residents, and very conscientious to keep it at the one. And at present, that one is actually doing a little bit better. So it's encouraging news. So.
And I'm sure that every resident is in a private room. So
that's probably one of the biggest benefits of being at Sholkoff. You are in a private room, so you are isolated. The residents are isolated. So you're not sharing a room with anybody else.
And how do you keep your residents connected with their family with the no visitation policy that's in place?
Those of you who go to our Facebook page or contact our social workers, we have a pretty active social media. They get to visit through Facebook. We also do FaceTiming. We're sending pictures. We'll encouraging letters, etc. So we've had a few folks that have come outside the windows. We've taken pictures of the residents. So different ways. Hopefully the weather gets a little bit better. And it'll open up some other opportunities.
Yeah, maybe August. So John's a very humble administrator. Sholkoff is one of the very few facilities in Western New York that has a Medicare CMS 5-star rating. Can't get any higher than that. John, how do you maintain such a rating? What's that rating based on? What are they graded on?
Again, it's based. We're blessed with a great staff, a lot of caring folks. And the ratings go into. They look at it. We have an annual survey through the Department of Health, and we've done quite well the last several years. Minimal, if any, deficiencies. Also, they look at our staffing and our quality of care, and it's looking at different areas such as pressure sores or infections, those types of things. And we've scored quite well, not only in our 5-star, but also New York State has a quintile rating of 1 through 5, and Sholkoff 5 years in a row has been in the first quintile, which is very significant when we're looking at quality and the quality measures and what we are able to do and do it quite well.
So I'll steal a line from President Trump. That's just incredible. Incredible. It's incredible news. Just incredible.
It's great.
So in addition to long-term care beds, the Sholkoff facility is a comprehensive center. So you also offer subacute.
Correct. We have 15 subacute beds, and we take various individuals who might have had hip or knee replacements, deconditioned, pneumonias, heart conditions, etc. And it is quite convenient being located attached, and we're attached to Niagara Falls Memorial, that we do have the best physicians and care that can be provided within Western New York. Subacute, we can.
It's aggressive rehab.
Aggressive rehab. And
how many times a day do they?
Twice a day, some at least once a day, but more often than not, you're getting twice a day of occupational or physical therapy or speech therapy. And again, it's various activities. The residents are pretty tired, for lack of a better term, after they get done with their rehab. And
it's well-deserved rest.
Absolutely.
And then, of course, in addition to long-term care and subacute, several years ago, we entered into a partnership with Niagara Hospice, and we created a hospice unit on the second floor of Sholkoff. It's referred to as David's Path. Very quickly, the story behind that. David Winker was a individual with intellectual and developmental disabilities who worked in dietary his whole life. Worked in dietary for 42 years, and he only called in sick one day in 42 years, one day. And he felt so guilty that he called in sick that he confessed the next day to a supervisor that he really wasn't sick, but he wanted to go fishing with his brother. And here's an individual who rode his bike to and from work 9 months of the year, 10 miles each way. He used to get to work an hour early to make sure he wasn't late, and he would get home an hour later because on his way home on his bike, he had a certain path that he would take, and he waved hi to the same individuals that he ran into every day. David, when he announced his retirement, 1 month before he was supposed to retire, he was diagnosed with late-stage cancer, and sadly, he passed away in the hospice house shortly after. And so it was very fitting for us to call the unit Dave Winker, the legacy that he left behind. And so, John, why don't you share with us what's involved in that program and how people can get referred into that program?
It's a 10-bed unit with in collaboration with Niagara Hospice, and residents who are end of life or not as imminent. It can be months. They have a condition that might be considered end of life. What would happen is if they're in the nursing home or out in the community or in the hospital, if they would benefit, there's qualifications per se. If they would qualify, they would be able to be admitted into this unit. And again, it's all private rooms. There's dedicated staff from the facility, plus hospice is on site daily.
So it's the actual hospice staff that's taking care of patients,
correct,
as well as our staff.
Yes.
In a coordinated manner.
Our staff, our nursing staff, is there every day, 24 hours a day, and hospice is there daily, and they're also there when the need arises, more urgently if needed.
And for those that would like to donate to David's Path, the Niagara Hospice program, David's Path at Sholkoff, we take those donations in memory of your loved ones. Thank you.